this particular lady has said, can I improve even though I've had surgeries and they've pretty much done nothing? So this lady has had one of the surgeries that you get that you have with endometriosis, and she said, I still feel extremely unwell. I'm tired. I'm still having issues.
Yeah. So specifically if these symptoms are around fatigue, bloating, etc., surgery often doesn't fix that. In fact, surgery can make it worse.
Yeah.
Because this is where the functional approach comes in and actually looking what is causing the fatigue and what's causing the bloating and what's causing the brain fog and what's causing the other digestive issue, which oftentimes actually have nothing to do with endo. So you can remove that excess tissue. And I guess if it was in certain locations where you might even started to sew together certain organs, that person's going to be in more pain, and perhaps the surgery may have potentially helped with some of the pain levels, but not with any of the other symptoms. Some women even only start the bloating issues after surgery because we've disrupted the microbiome, and now we have essentially started a cascade of like dysbiosis as a result of surgery. So these things aren't always just beneficial. They come with a lot of side effects, and also to mention that obviously surgery is an inflammatory event. So we want to make sure again that we address that inflammation internally, that we are working actively in lowering that inflammation, because otherwise those other symptoms are just going to persist. Yeah. No surgery is just magically going to take away chronic fatigue. No surgery is just going to magically take away chronic bloating. Okay, these things are often getting worse as a result of surgery. And this is where a whole body approach comes in. I'm not against surgery, but I think surgery should happen together with, actually looking at whole body health and helping someone out with their gut health and all of the other things that we talked about, immune system, etc.